Ma'am, we'll start the session, ma'am.
Okay. Oh, yeah,
Okay.
sure.
Okay.
And I think we all
Try
needed
any
that.
queries you can ask. Participants, if you have any queries, you can ask now. Ma'am, Divya ma'am, mute your mic.
Sorry, ma'am. Okay, ma'am.
Okay.
Okay, we'll start, and then I'll take questions at the end. I have a
Okay,
few
ma'am.
more things to share. I'm sure you, again, I was, a bit concerned when I did this slide that you might have already listened to it, but everyone's perspective could be a bit different. So let me share again. Can you see my screen?
Yes, ma'am. Yes, ma'am.
Okay. So the next interesting thing is the augmented reality in the surgical world. So what we mean is, see, when a surgeon does a surgery, first of all, sometimes the incision, we all don't want to have a very big scar in our tummy or on the back. You don't want to have a big scar. So usually surgeons are very keen to get a small incision to get to the area where they want to operate. And also, once you go near, for example, when you're operating in a bowel, what goes underneath the bowel? The major blood, inferior vena cava and aorta. Okay, I am sure a surgeon won't hit that, okay, because they are very experienced. But there are also smaller arteries and veins that go near it, which you don't want to hit. For example, in a C-section, cesarean section that many women undergo, while you are operating, the urinary bladder is very nearby, and the urethral injury is very common very commonly happen with the cesarean section. Now, to prevent all these things, what does augmented reality is where you can project the holographic images of where the surgeon is operating, helping them to visualize better about what they are operating, and also planning upfront using those bigger images of their scans or images, and has made a tremendous difference. This is from what I read. I'm not a surgeon, and it is said that many of the big centers have got this, but at where I worked as a consultant, East Surrey, we don't have this much of sophisticated thing. I'm sure it is under trial in some of the research institutions. Especially, they say the spinal surgery, which is very complicated to look at the vertebra and assess where to go, what to do. It has made a huge breakthrough. What else with augmented reality? This is something I really, really love it. Okay. And learning medical education. I'm sure you would have had a session on this, and it's so much, I just sometimes wish why I could go back to my medical years. I still remember the days when in my first year, I have to go to this dissection hall and, learn to do the dissection to learn about human bodies. And now they say with virtual augmented reality, students can learn from their own room. They can sit and visualize the anatomy of the human body. Even they could do dissection of virtual bodies. And also the histology. That's something, I'll tell you something really interesting. There is a YouTube channel. They are not a virtual reality or augmented reality. They are simply, visual aid. They have beautiful videos on immunology. Immunology is a complex field. Hematology, including what I do, the understanding the cellular pathways in hematology and immunology has opened up a new understanding of our, and once you learn it, you will know each one of us are a living miracle. How could this be so complex? And this is why sometimes people say that evolution happened just like that. We all came from nothing. I don't believe in that. We are such a complex being, more complex, than the computers and the things that we have discovered. Our cellular pathways are like one coordinated way of functioning from top to bottom. Amazes me every day. And this YouTube channel, if you have children, maybe around like 9 to 14 years old children, if any of you have, I would certainly recommend. It's called Kurzgesagt. And they make lovely videos of immunology and how the immune cells interact with each other. Immune system is the policeman of us. They are more as disciplined as our Indian army. They know what to do, and they do it religiously. I'm telling you, religiously. They don't go wrong. They die for us every day. Every white blood cell of you fights the bacteria and the viruses, and they sacrifice themselves to keep you alive. Isn't that amazing? And why do they do it? We don't know. You must know that these cells are living cells. There is a beautiful cell called Langerhans cells. Okay, they are bigger ones, and they live near the tissues. And you know, they are like the big boss. They walk slowly, monitoring the skin, what enters, what to do. It's so fascinating. It's so fascinating when you understand your own body. And when I was learning as a medical student, I had to imagine these things with the images that was given in my textbook. Now, not only these YouTube channels, this virtual reality has made them possible. How a liver looks, okay, lobes, there is a gallbladder, there is a duct connecting, and then what goes into the liver. I don't know how many of you know liver cells are hepatocyte or hexagonal. Okay, hepatocytes are hexagonal shape, and then inside how the bile comes, how the arteries supply, and how do they form. And same way, kidneys are cup shaped. These things, beautiful visualizations, you know, made possible by this AR. I'm sure it's a super happy learning for anyone who chooses medical field. Currently, I went through the internet and I know there are companies who have got this. For example, is it 4D or something? They have already released and it's available to use. That's something, an amazing breakthrough in medical education. What's next is virtual reality in medicine. So what's the role? So as you all know, I'm sure virtual reality is a computer generated environment where we can be present for various reasons. And such environments are, it is said that, can be used in treatment. How? One example is mental health. There is a condition called phobia. Phobia is fear. Fear means if I'm invited to talk today, and certainly before I started, I probably would be feeling a bit nervous. Very normal. And if this is like, you know, I'm hiding behind an online screen, it makes life easier. But if I'm in front of a real audience, it can be even a bit more nervous. But I still can manage and I still can deliver. There are people, however they try, they can't overcome this fear. They can even black out on stage. And they do have, I said that there is a huge connection between our mind and body. When the mind goes into fear, the body feels it. There's tummy ache, there's sweating, the heart rate goes up, and they become shaky. They might, as I said, they might even black out. So this is called phobia. Phobia for public speaking, phobia about what is called as claustrophobia, a closed space. Arachnophobia is for fear of spiders. Some are afraid of heights. I've had even a patient who was afraid of blood and wouldn't put a needle. You know, blood testing can never be done on him. He's so much, you know, he panics. So one treatment for this phobia is giving an opportunity for the patient to be in that scenario for a fraction of a second and come out of it and feel, okay, I survived. I'm not dead. Okay, then go back. Let's say somebody is scared of height. Then you go back to that height, a mountainous environment where you're standing, and you try to overcome your fear. Okay, and it's a safe and a controlled setting. And you can slowly overcome. This is a therapy. It's called exposure therapy. In reality, before, in public speaking, if you're afraid, you probably would be going to try once and see how you feel. And you might feel embarrassed in front of many people. But now with this VR, they can be in that place, in a virtual reality. That's an amazing. I don't know if it's available. Might be. I have a psychiatrist friend. I probably should have checked with her if they've got this available. But this is certainly available as a private company. I checked on that. It's available. Not in the NHS, not in the government service in the UK, but I don't know. I shouldn't say, but I don't know. That's the truth. Same way, pain management and physical rehabilitation. These companies that I've listed called Applied VR, Mind Maze, or it's called Science and Medical Realities. These are companies who actually are working on virtual reality in the medical field. And again, beautiful, exciting things. Although I must say, I don't like it when they use this VR for medical education. I don't think it's a good idea to keep wearing such things for longer hours, especially our children in this world who are exposed to, in screen time for hours and hours a day. I don't think I would add this to my children in any way, but this is just my own opinion. Everyone has different opinions on technologies. Okay. I think we have a few more things to go through, and then I will take questions. Now, having AI, AR, VR is one part of the newer innovations. There is much more. There are newer technologies which I thought I will share with you all. Other than this AI, one thing is gene editing technology. So in the image, you can see there is like scissor-like thing that can cut a DNA and take a piece out. And similarly, we can replace the defective gene with a healthy copy. And similarly, gene can be inactivated, or newer genetic material can be, inserted. There are lots of diseases that occur due to fault in the gene. And for example, cystic fibrosis. It's a rare disease. It happens due to certain mutations. There is a condition in hematology called sickle cell anemia. It's a very prevalent disease in Africa. It is said that probably that gene change happened. It's a probable, it's a theory to protect them from malaria, because malaria was so prevalent in olden days in Africa at that time when we didn't have any treatment. Their own red blood cells did this mutation so that malarial parasites cannot attack them. Or maybe malarial parasites won't survive in them in a sickle cell genetic changed red cell. But that sickle cell in a bit of a severe disease cannot survive as a function as a proper red blood cell either, forming anemia. This is called sickle cell anemia. And these diseases, if you can correct that gene change, can be treated. It's still under research. It's not still available for sickle cell anemia. There might be gene therapy for conditions like cystic fibrosis. And this has been very much perfected with the novel technologies that's becoming widely prevalent. Then there is another technology I wanted to share with you all, nanotechnology. Now, the word nano itself is self-explanatory. Is 1/1000th of a meter. So we want to go and manipulate the matter at the atomic and the molecular level. And what's the advantage? There are varieties of applications that are used using this technology. One is something that's easy for us to understand is targeted drug delivery. For example, sadly, some of you might have, encountered cancer in your family or your friends. When the treatment starts, you would have seen them losing their hair and having the nails stop growing. Why? Because cancer means the cell divides at a very rapid rate. The cell division is much faster than the normal cells. That's cancer. So the treatment called chemotherapy that we give mainly targeted to stop the cell division. So when we deliver that drug, it not only stops the cell division of the cancer cells, but also any other fast dividing or fast growing cells in our body. One is hair. Hair grows regularly, nail grows regularly, and our bowels, bowel cells replenish very regularly. And that's why diarrhea is a very common side effect. Hair loss and nail gets impacted. Now, what if we have a method by which we can deliver these drugs only to the cancer cells so that we can reduce the side effects of all this extra things that's happening to us? And also that will certainly improve the efficacy when you can be so targeted. For example, liposomes or nanoparticles made of lipid bilayer, and that can be encapsulated with a drug. And these liposomes can identify the cancer cells, and they are built in such a way to identify and deliver the chemotherapy to the cancer cells. This is a newer technology. Again, I don't know if it's widely prevalent or is it in the research stage. So far, in my practice, I treat cancer. I'm currently in the business world, but I treated cancer almost every day, and we didn't have an opportunity to work with this newer technology. But hopefully, sure, very soon it will be there. Now, the last one, today's session, is a very interesting one. And it's called regenerative medicine. It's again a self-explanatory one. And it's the most fascinating thing for me. Helping us, this technology, it's not technology, it's technology and more. It's a kind of repairing and replacing our own damaged tissues and organs using our own body's healing mechanism. See, our healing mechanism is again a very complex, intelligent one. Like how I talked about the policeman of our body.
Dinesh Kumar sir. Dinesh Kumar sir, kindly mute your mic. Dinesh Kumar sir.
Sir, ma'am, if you are a host, then you can mute them.
Yes, ma'am.
Oh, okay. Don't know.
தண்ணியும் தேடுறேன் இல்ல நான் சொல்றேன் கேக்குறேன் உங்க தண்ணியும் தேடுறேன் நீ.
Okay, here we go. Now, the regenerative medicine, again, as I said, we have extraordinary healing capacities in our body. One is the policing immune cells that protect us. Similarly, we have a very good, like for example, if we have a cut, okay, within the next few minutes, we stop bleeding. Let's say, what if that doesn't happen? We take it for granted. We always think, oh, cut, the bleeding will stop. But there are people for whom the bleeding doesn't stop. It's many conditions. The one condition is called hemophilia, which runs in royal families of European, especially, is very common there. And so our healing mechanism is hugely intelligent system. Now, using this healing, how could we capture it outside our body and then use it to build our damaged tissues that happen during the old age? For example, arthritis. Osteoarthritis happens as we all grow old. And can we reverse that change? This is regenerative therapy. And its applications are very interesting. So this is what I explained. The core principles of regenerative therapy is stimulating our own repair mechanism, using the cells and tissues taken from our own body, or it could be engineered in the lab. And then we combine it with different technologies like gene therapy, tissue engineering, other technologies to deliver it to our body in a more precise way. Now, this is one area where I have had the opportunity to work. For example, one is called CAR T-cell therapy. T-cell is a type of white blood cell. Now, chimeric antigen receptor, CAR stands for chimeric antigen receptor, which means we take the patient's T cells, we take the patient's blood, then use machines to separate the T cells and identify them, then insert this chimeric antigen receptor onto those T cells. So these T cells become super intelligent T cells. They are given some super, it's a secret code to identify that particular cancer that we are interested in. For example, acute lymphoblastic leukemia, diffuse large B-cell lymphoma, and mantle cell lymphoma. And when they relapse and we can't cure, this is like a rescue treatment. And we then introduce this CAR T-cell into the patient's body. And this CAR T-cell with its secret weapon, which knows how to identify the cancer cells, can fight and kill those cancer cells. This treatment, while I was at King's College Hospital training, was under trial, and we have been giving to our patients. Has got its own some serious side effects. Sometimes these T cells, become so activated, they release something called cytokines, which can, create some unwanted serious side effects. Putting that aside, it has also worked wonders in some patients. Especially in diffuse large B-cell lymphoma, there are patients who have entered remission with this novel treatment. Same way, there is another condition, treatment called platelet-rich plasma therapy. Now, this treatment, I can say, is very widely prevalent nowadays. And not only in hospital setup, it is used in cosmetic setup, where especially, if men with hair loss like alopecia, the frontal baldness, and women when they attain menopause, again can lose that hairline thinning in women. These things can be treated using platelet-rich plasma therapy. So what is this? Again, taking our own blood and then separating the platelets. Now, platelets help in coagulation of blood. They also contain growth factors. They are healing mechanisms, and it can heal the tissue, it can regenerate, and it can stimulate new blood vessels and hair growth. So platelet-rich plasma therapy is used in variety, even in arthritis for pain relief, it's given. And there are many more regenerative therapies I can keep on talking about. For example, the stem cell therapy. I don't know how many of you know what is a stem cell. I can talk about it just out of interest to be have an information to you all. Stem cell is a cell in our body which is like from where all the cells originate. This cell, as its word says, every tissue can be stemmed out of a stem cell. Can differentiate into a bone, can differentiate into a muscle, can differentiate into liver, can differentiate into heart. Isn't that wonderful? And we all have stem cells in our body. Especially when a baby is born, the umbilical cord blood has good stem cells. And there you might have heard like cord blood donation, where they collect this cord blood and store it. This is the reason. We keep the stem cells. And where is it used? In patients with bone marrow cancer, where you want to eradicate their own bone marrow and introduce new bone marrow, we can use the stem cell. This is called bone marrow transplantation, a very toxic procedure, but works well in many cancers. So these are all examples of regenerative therapy. And this is a very fascinating field, along with the newer technologies that we all have. I am sure there is much more, and it's already available, being practiced, and more things will come up. I think that completes my talk. And before I finish, before I let you all ask questions, my feeling, I can never overemphasize on prevention than cure. Everything we talk about so far is curing illnesses. The new technology, the new therapies, regenerative therapy, gene editing, and nanotechnology, everything, but the prevention is better than cure. When it comes to prevention, I told you 25% of deaths in India is due to coronary heart disease and heart attacks. And it is said, if you lose 5 to 10% of your body weight, if you are an obese person, not if you're thin, okay? If you're 5 to 10% of body weight, that can reverse major impact by diabetes, cholesterol, and their risk of creating stroke and heart attacks. In the same way, I don't know how many of you do your job by sitting. It's a major killer, I'm telling you all. In IT profession, if you're a professor, that's a different, maybe you will stand and teach. But if you are in IT where you do a desk job, you sit and work in meeting for hours. Every 2 hours you sit continuously every day increases your risk of bowel cancer by 2% every year. And in the same, you can reduce the risk of bowel cancer by 25% if you break up your sitting every 2 hours mindfully. Same way, if you can moderately exercise 150 to 300 minutes per week, you can very much reduce the risk of heart attacks and stroke due to diabetes. These are all not my own, facts. These are research papers that have been published. So I can never, and this is lifestyle changes. And then smoking and alcohol contributes a lot. Then food we talked about. I already talked about the food habits that we can all adapt. In your 40s and 50s, mindful eating is mandatory, especially women when they go through menopause. Many go through menopause without even knowing the ill effects of it. Menopause brings a huge change in women's body. And from hair, from how your body fat gets distributed. For example, in menopause, it is very well known that the face becomes a place for storage of fat. Women's face becomes big. That's when you will see not only women, men as well. And so that distribution of fat even changes. And your risk factors for many diseases goes high. So change your food habits, control eating fatty foods, sugary foods, and cut down on meat, non-vegetarian, increase your plant-based food, and then more than lifestyle, nutrition. The third thing, with this I finish, mind. Please don't underestimate mind. Nobody thinks about mind. I'm telling you today here, every one of you wouldn't even think about who I am when I think, what kind of personality I am. We all are different people. Some of us handle stress very easily. Some of us become anxious and depressed. Our personalities are very different. Some of us choose a job and enter into IT and do very well. Some of us enter into IT and feel, my gosh, I can't handle this stress. Same way as a doctor, some of the doctors, they can work until their 80s because they are so passionate, while some of them can't take criticism. They are afraid of making mistakes and give up. Our personalities are very, very different. How we think forms our reality. That's the absolute truth. what we eat is our future, and what we think is our reality at this point. So think well. When you think well, you have a better results in your life. And by thinking, you need to be mindful about what you think. I'm telling, in England, there is a anxiety in women is around 40%. And again, anxiety in women is mainly due to the food habits, which is established very well now. So thinking about what we think, how we deal with stress, can you remove those negative thoughts, insert positive thoughts, and mindfully taking care of mind, do some meditation, or even go for a brisk walk. Brisk walk outside will cure many mental illness. So please take care of your mind. And when you do these three things, many illnesses can be prevented. With that, I'll stop. And I'm happy to take questions. But having said that, I am not a technology person. So if I don't know the answer, I'll get back to you later. Sudha, I'll leave it to you. Thank you very much for having me.
Ma'am, one question, three questions asked in the chat box. Can we give the link of the immunology website? If it
Oh,
is
yeah,
possible?
certainly. I'll forward it to Professor Uma Maheshwari. Is that okay?
Yes, ma'am. Yes, ma'am.
Yeah. Okay.
Then, ma'am, Aruna ma'am is asking for diabetic patients to blood clotting time.
Ma'am, I'm sorry. Actually, that is not the question. Actually, when you were talking about the blood clotting time, that time you were talking about some other people also. So I told for diabetic patients also, because they are having the tablet, that metmorphine. Because of that one, that blood clotting time increases. That's what I wanted to
Oh,
say.
I see. I see. Is it a impact on the blood clotting? It's a very something interesting. I'll have a look on metformin on blood clotting. I haven't looked at it, but I can take a look. So, Aruna, you are saying it impacts the clotting, is it?
Yes, ma'am. Normally here in India, blood clotting time for the diabetic patients is little bit high, because above the normal time, because they are taking the metmorphine.
Oh, I see.
That's why here they used to check the blood clotting time for diabetic patients periodically.
Diabetic patient before they prescribe metformin. Interesting. See, these things, how drugs impact us is also very variable in every country, and who gets what side effects also we don't know. But metformin is a wonderful drug for diabetes. It reduces the insulin resistance. Insulin resistance is a whole topic that we all can talk for hours and hours, because one major cause of all half of our health issues is insulin resistance, which starts from a very young age. If we are not focused on what we eat and what we do, how much we move, and what we think, are we sleeping well? Again and again, these are the basics. If we do get these things right, our health will most probably is going to be right. And beyond that, everything we cannot control in life. Some things will go wrong despite whatever we do, but at least we know we have done our part. But it will. There are researchers that's very well proven. And metformin is a way to reduce insulin resistance, Aruna. It's a tablet form. But doing all these additional things, we can control insulin resistance by our own actions as well.
Yes, ma'am. Thank you.
That, Aruna. I'll take a look at it. Interesting fact. Thank you for sharing that.
Yes, ma'am. Yes, ma'am. And then another one more point what I wanted to know is, actually, I am interested. My core area is artificial intelligence and machine learning. So, is there any possibility of collaboration regarding you are into drug discovery, and then if there is any possibility of collaboration with artificial intelligence and machine learning, then that would be great. So, can you look into that one also?
Certainly, Aruna. Currently, as I told you, I am just, studying about AI in healthcare, and I'm not into any field where, AI is applied. But if I come across any opportunity, send your profile. I'll keep it, and I will certainly get in touch with you if I come across any opportunity. But with me, I don't have, because as I said, I have a startup on obesity. and which we are not involving AI. And I have a women in business charity. And these are the two things I am actively involved currently. But certainly I'll keep you posted.
Yes, ma'am. Thank you, ma'am.
Thank you, Aruna. Any other questions? Okay, I think that brings to the...
Can I approach Uma Mageshwari, ma'am, for your contact details so that I can...
Certainly,
Yes.
Aruna, please do. Yes.
Yes, ma'am. Thank you.
Welcome.
Ma'am, is there AI techniques used nowadays to learn medical subjects, ma'am?
That's interestingly, I saw that, and that is available to use. And that company name, I don't know, it's called 4D something, and they are ready to use. But I don't know how many are using it and all those things. I can check with the medical students, but it is ready and it's available.
Okay, ma'am.
Yeah.
Sir, any other questions are there?
Okay. Is that all? Shall we end, Sudha?
Yes, ma'am.
Okay, thank you very much. As I said, it's a great privilege for sharing this, whatever I know. And I hope that this will make some difference to what you do, and a bit of an addition to your knowledge. And thank you very much for Satya Sudha for introducing again. And thank you to Professor Uma Maheshwari and for this amazing opportunity to meet you all, some excellent people. And I wish you all the very best. Thank you.
Thank you, ma'am. Thank you for the wonderful session, ma'am.
Thank you.
Last year I have attended your seminar.
Really?
It was
All
very
right.
interesting, and today also it was very awesome, and we learned many things in the medical field related AR VR, ma'am.
Thank you very
Thanks
much.
for
And
spending your time with us, and you
thank you.
shared your knowledge with us.
It's
Ma'am,
my pleasure.
ma'am, I am really sorry to disturb you again.
Uh-huh.
And then another one more thing is there any other short-term course in London or otherwise near to that one regarding this, what you are doing, drug discovery and then artificial intelligence related courses, short-term courses, I would like to know. So I will
Certainly.
send you the questions and
What
then you...
I do is AI in healthcare in Stanford, but that is more of an AI healthcare administration and how AI is applied in, for example, in insurance, medical insurance, and how the National Health Service is set up, and how AI is helping there. That may not be very helpful for you, but in drug discovery and AI, there might be courses. Certainly I am not in pharmaceutical industry, but I can have a look and I'll let you know. I'll message
Yes, ma'am.
Professor Uma as well. AI in
Yes, ma'am.
pharmaceuticals. If you are
Yes, ma'am.
interested in pharmaceuticals, there are so many pharmaceuticals in India, and I must say that they all are million-dollar companies, and pharmacy is one beautiful place. There are scientists, there are intelligent people, innovators, and they are game changers, equally good in India. So explore there as well.
Yes, ma'am.
All right, then. Shall we end?
Yes,
Thank you
ma'am.
very
Thank you.
much. All the best. Bye-bye.
Thank you, ma'am.
Bye-bye, Sudha. I'm gonna
Thank.
leave. Bye-bye.
Bye, ma'am.
So, dear participants, the feedback link will be posted for both the sessions. So today we will wind up the sessions now. Tomorrow we'll start session at I think earlier we will start. Already it is in schedule. So kindly all of you join at the time. Tomorrow session is going to end. Then finally you will have the online test and all. Then after that you have to submit the feedback form in ATAL portal. Then after that validatory session is completed the 6 days ATAL FDP. So kindly cooperate in this regard. So I'll post the feedback link in the group. So kindly fill up both the sessions feedback link. Thank you.
Ma'am, thank you for sharing the videos, ma'am. It is industry related videos we have shared. That is very useful for the participants, ma'am. We thank you for your session, ma'am. We have a good time to spend a lot of information, ma'am. Thank you, ma'am. Dear participants, kindly fill the feedback forms. Thank you all.